Hello everyone, I'm Dr. Ifraim and today we are going to learn about the general principles of doing short cases in your exam. So the first thing is that you always listen the command of the examiners very carefully. For example, if the command is do the general physics examination, then you start doing the steps of general physics examination that are vitals, anthropometry, head-to-toe examination, and then you do the relevant clinical examination depending upon the findings that you have seen in the previous three steps. So always listen to the command because if you listen to the command, the scheme of your examination would change. In the same case, if the examiner tells you that child is of short stature and mother is concerned about the height of the child, then your scheme would vary. You will start with the anthropometry and then you will do the maneuvers of short stature. And then you will complete your examination by doing the relevant examination at the end. So it's important that you listen to the command very carefully. After listening to the command, it's very important that you introduce yourself to both the child and to the parents as well. It's a very common mistake seen in the students that when they are given the command, they just introduce themselves to the parent and skip the introduction to the child. It's very important you need to talk to the child and try to introduce yourself to the child. That's so you start building rapport with the child. It's very important. It's the first step that you start building rapport with the child. So introduce yourself. So along with introduction, you need to tell to both the child and to the parents what are you going to do with the child. For example, if the exam command is to the general physical, again, you need to tell the parents that I'm Dr. XYZ and I'm going to examine your baby and I would expose this and I would examine the relevant things, so they may not be afraid of the examination as well. So that's how you become more open to the child, and always have a proper exposure while doing the examination. And again, I'm putting example of general physics examination because it's a very common command in your clinical examinations. So if the command is do the general physics examination and relevant, the ideal exposure is shirt should be off and the trousers should be rolled up above the knee. So this is the ideal exposure for doing general physics examination in the child. After the exposure, whatever the command is, be gentle with the child. Especially if the child is having IV and pass, you need to avoid that area. I have seen many good students failing in the exam just because they inflicted pain and they were not gentle. They just after listening to command, they just jumped on the patient and they were just tossing the baby here and there to just complete their examination. While you are doing the examination of child, try to build rapport with the child, and rapport can be built that you can start talking to the child. Keep on talking while you are completing your examination. For example, common questions are what's your name, what do you do, how many siblings you have, and do you study, what are your hobbies. These are common questions that you can keep asking while doing the examination. It will keep the patient engaged. Again, I will emphasize on that, please avoid the tender areas because this is one of the main reasons of failure in exam, that you inflict pain in the child. So always ask whether the child is having pain before touching the child. Another important thing is please try to manage the time. In CPSP exam, the time allotted for short case is 5 minutes. In your practice, when you're going to the wards, try to set alarm for 4 minutes and 30 seconds so that at the end of the day or on the day of exam, you might have 30 seconds to think about your finding, and you may rearrange your findings. And this can only be learned with practice. So practice a lot, practice, go to the wards, ask your seniors to watch you while you examine. So that's how it will build your confidence as well. The more you practice, the better you perform on the day of your exam. Next is be confident, and confidence comes when you are well prepared. So one thing is you should be well prepared, and second thing is try to dress well and smell well, and try to have a smile on your face on the day of exam. It's very difficult to keep, but it's important. If you can master that, it will boost your confidence. At the end, once you have completed your examination, cover the patient and always be grateful to the child and to the parents because they allowed you to do examination on the day of your exam, and that might be a reason for your success in the exam. So always be thankful to the child and to the parents. Now you need to take a deep breath, rearrange your findings in your brain, and start your description. So there are three components of description. You start with an opening sentence, then you have a line of your positive findings, and then you have a line of your important negative findings. That's how you complete your short case. And I wish you all the best for your exams. Keep practicing. Thank you.